yonde motema nangai. Ma chérie, yonde solution yalove nangai. Nikikuona roho yangu mimi natulia. Nikitembea na wewe nasikia furaha moyoni. Ma chérie, je t'aime mon amour. Nalingio na motema nanga nyoso. Chérie, nalingio yonde wanga wa motema.
Unavyonitazama baby, oh. Unavyonipapasa baby, oh. Niambie niongeze baby, niambie niongeze baby, maana your love baby, your love, your love, your love. Sioni mwingine baby, ni wewe tu. Sioni mwingine baby, ni wewe tu. Nashukuru Mola kukupata baby wangu. Nashukuru Mungu kukupata my love. How we love you.
To talk about dementia in Africa, including insights into a research study published in the South African Medical Journal, conducted in rural Eastern Cape by Dementia South Africa and other partners. But briefly, I would like to talk about Dementia South Africa. Our vision is a South Africa where dementia is recognized and acknowledged using person-centered principles with respect and dignity for all affected. Dementia South Africa is a national organization that was established in 2006 and which is affiliated to other international organizations. It is affiliated and involved with other South African bodies, including tertiary organizations. It is giving services to family members of people that are living with dementia, people with dementia, carers, professionals, and facilities caring for people living with dementia. Since COVID-19, our services are now offered virtually, although, again, we still do home visits, to people that are living with dementia and their family members. We deliver services to people, to communities and families. We also have a WhatsApp group that currently has about 246 people. It is a safe space so that families can connect and not feel isolated. Information from reliable sources is shared and encouraging and respectful. We also have Zoom meetings every Thursday between 1 and 2 p.m. We have a virtual support group meeting. We still do the training workshops that are held in person in Cape Town. And during COVID-19, we recorded webinars. So we have our YouTube channel where one can get the webinars. This was done to continue the education on dementia. There is paucity of research into dementia in Africa. It is believed that together with the escalating aging population in low and middle income countries, the dementia burden is increasing. According to the African Dementia Consortium, the research which is available and published indicates that there is a dementia prevalence of 2.3 to 20%, with increasing mortality in parts of rapidly transforming and aging Africa. That information, one can find it from ALS journals on .online, library.wiley.com. Some of the factors are differences in nutrition, cardiovascular factors, other diseases and comorbidities, infections, mortality, and lack of early detection are likely to contribute to lower incidence. The most common dementia subtypes are Alzheimer's disease, vascular dementia, and HIV/AIDS neurocognitive dementia, which is abbreviated as HAND. And this is according to Africa Dementia Collaborate. We also did a collaborative study, which the pilot phase, we did it in Cape Town. Dementia South Africa contacted UCT, who got together a specialist team, and the principal investigator was Dr. Celeste Jager. The co-investigators were Professors Mark Combrink and John Joska. There was also a team of 6 others, and they are all leaders in their fields. The topic of the study is dementia prevalence, assessment tools, and care needs in low and middle income countries. isiXhosa speaking elders in rural South Africa. What we did was to do the essential to test the isiXhosa translations of the assessment tools, collaborated with a partner organization, Ikamba Labantu, which has senior clubs in communities of the Western Cape, where 100 seniors participated. The challenges that were identified were transport and time, and that made us change the fact that people had to come to Ikamba Labantu. The social worker had to go to the groups. Parallel to this, Dementia South Africa ran awareness talks to other members of the community about dementia and memory screening. In South Africa, we have 9 provinces and people and 11 official languages, and a total population of more than 50 million people. But we only have 12 geriatricians and 10 are in private practice. Allocation to mental health. Then again, in the Eastern Cape is the most dysfunctional province in healthcare provision and service. Services and valuable projects, health and social care to older persons are not a priority, and services are fragmented. The facts are, in 2012, approximately 58% of the 36 million people living with dementia worldwide are living in low and middle income countries. We call that LEMIC. And this is set to rise to 71% by 2050. Another fact is projected increases for sub-Saharan Africa are between 70 to 90%. The 1066 Dementia Research Group in India, China, Southeast, and other countries did the research. More recently, there's a group called Stride Research, which was conducted by various country members of Alzheimer's Disease International, which is based in the UK. America and Africa recorded prevalence for dementia as 3.9% for persons over 60 years. Once again, the paucity of research in South Africa is highlighted. In South Africa, extremely limited research is conducted. Small Free State study investigated dementia in an urban Black community. Prevalence of 6% was found. According to the World Health Organization 2012 dementia report, HIV-associated neurocognitive dementia equals to between 15 and 30% in untreated populations, presenting neurocognitive impairments, emotional disturbances and motor dysfunction, which were linked to HAART, H-A-A-R-T, which is highly active antiretroviral therapy. And the prevalence is 10% with annual incidence of 1%. Dementia needs action now. Why? Mental health, including dementia and care of older persons, has only 12 geriatricians in South Africa. And it's not recognized as a priority. And there are limited services, no proper care, no skills development. Dementia, is it neurological or psychiatric or social? That is one of the problems that we are experiencing in South Africa. Dementia is shrouded in myth and stigma. The language and cultural appropriateness of assessment tools associated in indigenous culture to be the work of ancestors, that is dementia, in other cultural groups. Again, in other indigenous cultural groups, it is linked with witchcraft, particularly in women, as they are said, they are giving birth to the next generation of witches. Another factor is the darkness of our complexion, particularly in parts of Africa. Dementia has killed, but many people have been killed, but many times brutally raped over a number of years. There has been an abuse and vulnerability and neglect. This comes to no epidemiological studies plus no figures or prevalence equals to no need, no action, and no funding. And as I mentioned, we did this, the pilot study in Khayelitsha and Gugulethu. Then a second phase of the study, we did it in Amatole district in the Eastern Cape. There was a sample of 2,000 elderly people that was tested in this area. This is a very rural and remote area. It is impoverished, has high unemployment, a rate of about 89%, and also high rate of HIV infections. In this area, there's only one hospital and 10 community clinics. DementiaSA collaborating with an NGO in this area that has provided services for many years. They were doing essential work, working in rural communities, and their topic is health in every heart. The community health outreach workers were given notebook laptops, which were customized, which had customized software, which would log GPS coordinates of every heart in entire geographical area and data on 6 healthcare domains and other vital information, including age. Dementia South Africa involved in the second phase of this project. What we were doing, we were training the community health outreach workers to do the data collection with questions pertaining to the study on the notebooks. Our director also visited that area many a times to see the area, to talk to the people, to talk to the outreach, to the community health outreach workers. And these were going, as I mentioned, they were going from heart to heart, using the assessment tools with the people, and including Dr. Diaga. The outcomes of this pilot, the second phase of this project was the prevalence and figures. We could have that. And we had advocacy, making dementia care a public health priority in South Africa. Advocate for better policies and to start discussion on a national dementia care strategy. Establish a working group on a dementia manifesto, but this ceased because of lack of funding. We had better understanding of dementia, screening, care and management of people living with dementia. We educate and re-educate on issues like abuse of older persons. We expose the vulnerability and marginalization of older persons, and especially those with cognitive and memory impairment. We launched the world's first speaking book on dementia to create awareness and educate people in isiXhosa. Remember, most of these people in this area are illiterate. They can't read. So the speaking book was helping them to listen to the information about dementia, what dementia is and how people have to be handled that are living with dementia. And this speaking book is designed and written from learnings from our national helpline, the pilot study that was done in Cape Town, and also in the hospital called Madwaleni, that is in the Eastern Cape. More outcomes, capacity building, skills development on all levels, including the use of standardized screening measures, investigate associated health problems, including HIV, depression, and nutritional status, development of a model recognition, a diagnosis, and appropriate care and services that can be rolled out and duplicated into other rural areas of South Africa. Using global practices to find and innovate solutions for dementia in local and especially in South Africa specific content. Not selling the speaking books, we were giving them out because we had a sponsor for us to do that. So we were not supposed to sell the speaking books. But now we don't have more, I don't think we have much of those speaking books. A reason being the funding, we can't produce them again, or print them again. That's the main problem. Otherwise, we were giving this freely to people in the communities, and each community health outreach worker would have one. And when we get a family with somebody living with dementia, we would give one to that family. Again, when we were doing the training workshops, every participant in the workshop or in the workshops would be given the speaking book so that, it can use it again in his or her area. So we don't have any more, like I can put it like that, because we don't have funding, but it was really helping a lot of especially illiterate people, yes, because they could listen as they couldn't read. In other cultural groups, when they have no answer to what the people are doing, or whether it's the sickness or that, they will say the person is being, especially dementia, especially with dementia, when they're talking about people that died many years ago as people, as if they are still living, you understand? So education, advocacy, if I might put it like that, is what is helping our communities. Just to give you an example, in Khayelitsha, there are healthcare workers or home-based care workers from Ikamva Bantu, based at Ikamva Bantu. So they were trained by us, Dementia South Africa, what dementia is, you know, the warning signs to pick up. And this lady was one of the this home-based caregivers. So there was somebody in the village, not in the township in Khayelitsha, that had to go to the toilet. The toilets in her area are outside. So she went to the toilet and didn't know the way back to the house. So everybody now was, she was just wearing a petticoat. Everybody was, you know, okay, I'm just jumping these things, the steps now. So she was found in somebody's house in the early hours of the morning. So she was taken as a witch that had fallen off, whatever. And then somebody posted a picture of this lady, you know, on Facebook. We have caught a witch in somebody's house. Fortunately, the caregiver, the home-based caregiver that is caring for this lady could see this and said, please don't hurt the person, because people now wanted to hurt her, wanted to beat her up, and she hid under the car. She said, please, that is somebody living with dementia. Don't harm her, you understand? So what I'm trying to get to, with education, they can be saved. Our elderly people can be saved. And again, even when I used to go to these rural areas in the Eastern Cape, you would hear people saying, I wish I had known about this when my grandma was, you know, was having dementia, but we didn't know. We thought she was being exposed as somebody that was practicing witchcraft. So the point that I'm trying to make is that advocacy, awareness talks about dementia, it's what would take us out of the trouble. It is what is going to give our elderly people the respect and dignity that they deserve during their time of vulnerability. Counseling goes a long way, because especially the caregivers, you know, the care providers for their loved ones, you know, we do a lot of counseling, and that is, we give them emotional support, and with a virtual support group, you know, it goes a long way. With a WhatsApp group, it also goes a long way, because people feel they're not alone, they're not in a corner, there are other people. So any form of support we do give, you know, to the people that are caring for their loved ones, because it's quite a huge task. It's a 24/7 task. So they really need to have somebody to talk to. You know, some other people would, because, you know, they are ostracized in a sense. So they would need somebody to talk to. We've got social workers at DementiaSA that one can talk to. But again, with the challenges of funding, we had to cut down to one social worker at DementiaSA when we had 3. And that 3 was not even enough, because we do home visits, you know, to the family members and do counseling in their private homes, or they come to our offices. So huge challenges, but yes, our director is also helping a lot in helping people, in supporting people. She has a wealth of information, because even her mom lived with dementia. Ever since that time, she started, you know, getting information about dementia, and then that's why she is a founder and director of Dementia South Africa. That's about all that I needed to talk about. And thank you, Dankie. Enkosi, Siyabulela.
sheri, nifanye nini unielewe baby, nakupenda. My baby we, baby we, baby we. Nifanye nini baby unielewe, nakupenda. I'm gonna love you, I'm gonna love you, love you, love you. I'm gonna love you, I'm gonna love you, love you, love you. I'm gonna hold you, baby. Whoa, yeah.
Sheri wanga wa motema nalingio, I love you. Nikikuona roho yangu imefarijika, nikikuona kwa mbali na kutazama kama malaika. Wewe wangu wa motema, ma sheri je t'aime, nakupenda sana sheri. I love you, I love you.